We'd now like to take a deeper, closer look at the whole school, whole community, whole child, holistic approach. I'd like to welcome Amy DeLisio, Director of the Center for Wellness and Nutrition. Amy is a well-established leader in innovative public health nutrition education and social marketing approaches, food and nutrition security efforts, school wellness initiatives, nutrition and health policy, and chronic disease prevention programs. Please welcome Amy.
Good morning, everyone, and thank you. And first, before I get started, I just want to shout out to the school community, because I know during the pandemic, in my own community, it was such a beacon of hope and changing and getting food to families and really being there, getting education and computers to families. So I know that was a hard transition, but I felt like schools were really valuable for our students during that time. So today we're going to talk a little bit about a holistic approach to wellness, focusing on the whole child, centering it on the child themselves. A little background about us. We are the Center for Wellness and Nutrition. We're a program of the Public Health Institute, and we really work on campaigns, programs, partnerships, and capacity building to bring wellness to all. So we really focus in on vulnerable communities, communities with less resources, and how that we can support different organizations. So our vision is a healthy nation where wellness is accessible to all. And we really focus on building leadership and capacity in community residents and organizations to have optimal health available for all. So I know you heard a lot about what is the reality of the world right now, and we've heard a lot of doom and gloom, but the reality is a little bit heavy, right? We're dealing with a lot of different things: the economy, inflation, poverty, racism, government dysfunction heavily at the federal level, pandemics and health, climate change. So these are impacting us and our well-being overall, but they're also impacting our students and our families when they think about these, and they're impacted and affected by this. If you're a lower income household, inflation is going to be a little bit more difficult for you than if you have higher income, right? The reckoning with racism, people are looking in America, but if you're not white, how are you feeling about this? You're seeing a lot of things happening. Pandemic and health, we've all been impacted by the pandemic, but we did see in the data, folks that were less healthy coming into the pandemic were more broadly impacted, right? So if you were already had chronic diseases or were overweight and obese, you may have been further impacted by the pandemic. So general health is really important, even in the face of a pandemic. And additionally, which we've heard from our first two speakers, what are some challenges we're facing in school communities? Teacher shortages, crowded classrooms, safety concern, student poverty, obesity and health again, adequate funding and learning loss. So I know there was a huge report that just came out this week, right? And our students are behind in math and reading. And it's not a surprise, but also thinking about that, what students are probably more impacted? Those that have less resources and less support at home probably maybe was already a little bit behind before the pandemic, and now they're behind. So how can we support those students? So you're facing with a lot of different challenges right now. In the classrooms, at your schools, but I know you're up for this challenge because we want to think about this holistically. Health and education go hand in hand. They impact our economy, our future, and we want to put them together as much as possible because we need well-educated students, well-nourished students. We need healthy younger generation to ultimately have a strong overall country, city, county economy. So we put this into perspective of health equity. What is health equity? You all have heard of equity, I'm sure, but it's really assurance of optimal health for all people. And everyone, it's where everyone has a fair and just opportunity to be as healthy as possible. And you can see around, again, this is also has the individual in the center, and those are the social determinants of health. There are many social determinants of health and conditions which people are born, grow, live, and age, shaped by the distribution of money, power, and resources that affect a wide range of health and quality of life, risks, and outcome. And you'll see one of those areas is education, but education can't do it alone. Education is a strong factor, but we also have to think about, do families and students have access to health care? Do they have transportation? Do they have social, emotional support? Some of these things they're born into, right? If you're born into poverty, that's where you're at. So we need to provide more wraparound services for them. And really, we need to meet people where they are. What do you need individually? Getting to know and providing those services, not only on an individual level, but also, at a community level. We need to remove obstacles that make people healthy. So some of them are hard. It's hard work: poverty, discrimination, racism. Empowering people, right? And some people feel powerless and they have less access to care. I saw a stat on that other slide where it said Spanish-speaking families had, they had more shame and didn't know where to go, and maybe it's a language barrier, or maybe their immigration status is preventing them from seeking treatment. So we want to make it welcoming and resources available for all. So that's part of equity. What does your community need, and how can I provide it to them where they're at? And then what is wellness? Wellness is an active pursuit. It's not just physical health. A lot of us think of it only as physical health, but it really goes well beyond physical health. There's mental health, environmental, social, emotional, and even spiritual health that makes you a whole and active person full of wellness. It's a holistic approach to health. And it's an active pursuit, but how can we make our environments more open to wellness? How can we model wellness behaviors for students? And how can we also teach them about wellness so that they are holistically taking care of themselves? So it's not just physical health, and all of these things are interconnected. And I think we're seeing more and more. Physical health has always been a really high priority, but mental health is coming up as an even higher priority right now after the past 2 years, right? People are feeling despair and reevaluating things. So overall, holistic health is a combination of both. So then we get to the school wellness. It's all the whole child, whole school, whole community approach. Again, the child is at the center. We're centering it around the children's needs. And it's a holistic approach to school wellness across, again, sectors. So all of these different areas within, which are 10 areas of school wellness, are different probably departments at your school and different areas at your school that you're working towards reaching that child. We view the child as a whole person. They have multiple needs, right? It's not just about test scores and education. I mean, it's important, but what else is going on with them that is impacting their ability to thrive in school? What else do they need? Let's take a comprehensive approach to learning to ensure that the child is able to reach their full potential. And there are a lot of barriers that might come up. So it's a community-wide approach, a school-wide approach, and schools are made of multiple little systems, right? Your classroom alone might be a system, your food service department might be a system, your school site might be a system, your district might be a system, right? So how can we kind of change the way we do business where we're making these systems work together and centering them on the child? It does call for greater collaboration across these different sectors within your school, right? So one person can't do this alone, but how can we work together to really meet the needs of children so that they can thrive and excel in school? So thinking about that in your classroom, how can you take this approach and embrace, I think I might have skipped, did I skip a slide? No. Okay, I did not. So in your classroom, so there's ways to really kind of tune in onto what your children's needs are, and that might help to refer them out to some of these other services within your school. But learn about your children's interests and what are students, know a little bit about their home life. What is impacting them at home that might make it hard for them to learn at school? Do they come to school late? Are they hungry? What other things are going on that you might be able to ensure that you can refer them to some other services to get them extra support? Model that kindness and patience and respect and acceptance within the classroom so that they feel more comfortable sharing their authentic self and being open. And really check on social and emotional health and wellness. There's different ways to do that, but even having opening questions every day or just checking in with students overall and keeping that openness so that they may come to you and tell you what things are going on. Or if you suspect things that are going on, you may be able to refer them to some of the other services in school that might help them get a little bit extra support so that they then can reach their full potential in the classroom. I touched on this, you saw the graphic, but today there are 10 areas and they're all very interrelated. But today I'm really going to focus a little bit on how can we maximize nutrition, environment, and services and family engagement to really center our work around the child. And I know other speakers today will talk about other areas, but these are the two areas I'm going to focus on a little bit more and how it might work in practice. So in nutrition, environment, and services, there's a lot of opportunity for students to be exposed to food throughout the day. And some students get more than half of their calories at school. Maybe they don't have a lot of opportunities to have meals at home, or during certain times during the month they don't have food at home or not enough food to eat. So where do they get food? Cafeteria is a primary one. Some schools are doing breakfast and lunch. Some do a summer meal program. Some of you might have a fruit and vegetable program where you're giving out more fruits and vegetables throughout the day. So cafeteria services is the main mealtime services, but then there's also vending machines that might be available at your school. They may have certain hours where they're available, but there may be less healthy foods in those. Student stores or concession stands, places where you're selling products to schools. Hopefully they're meeting school standards. I know during the school day they are, but sometimes after school and at certain events they're not. There's classroom rewards, sometimes can be food, although we don't encourage that. Classroom parties, when you're doing celebrations, there might be food brought in. School celebrations overall, there's things that revolve around food. Fundraisers might be food. And food is great, it brings people together, but we also want to have this opportunity in the school environment to really expose people and students and families to healthy food because, right, maybe they don't have that many opportunities in their own communities. Healthier food is more expensive, and this gives them an opportunity to try new things and get exposed. So food is all around, it brings people together, but we want to use it in a positive way. And nutrition and well-nourished students actually do better academically. And I just put the Maslow hierarchy of needs. I'm not going to go through that. But if you see the very bottom base of that pyramid, physiological need, right? It's food. So if your students are coming into class and they're not well nourished, they haven't had breakfast, or they've had unhealthy food, they may not be doing as well as if they're well nourished. We can see correlations with academic performance, better behavior, better skills and attitudes during class, improved attendance, improved focus. So they're better students when they're well nourished. So starting the day with a healthy breakfast, whether it's on site at school or hopefully maybe at home, they're going to be better able to perform and focus at class. So it is always great when schools offer breakfast on site because sometimes we don't know when students aren't being fed at home or they're running late or all of these different factors. Additionally, nutrition academic achievement, other things that are happening, food insecurity. We probably heard a lot about that during the pandemic, and it was already an issue prior, but it skyrocketed. And now, again, food prices are very high. Even though we got a SNAP benefit increase, right? It seemed like right after we finally got that after 20 years, okay, then food prices are up 10%. They're at their highest rate. So how do we catch up with that? And I know policy needs to catch up with reality. But again, schools are a primary place where we can help students be more food secure and more healthy. Again, lower income families are struggling to make ends meet. I know, for example, Los Angeles County has been following this throughout the pandemic, and they are seeing, the federal poverty line with a lot of these nutrition programs are up to 185 federal poverty line. But we're seeing families at 300% of the federal poverty line still struggling to put food on their tables. So food insecurity is not always, just in low income. It's in a little bit of higher income, and people are still struggling to feed their families. And when kids are not well nourished again and not getting enough to eat, they're not doing as well as school, and they may also act out. They may have behavioral problems, but it's really based on not being well nourished. Students that eat breakfast do have higher standardized test scores, and I know sometimes at schools I'll see those notes from my kids' school like, hey, we're having testing next week, make sure your students are eating healthy breakfasts, which of course that's great, but we need them to eat healthy breakfasts all the time. But it's good that we know there's a link, right? Because schools put those messages out during those testing times, but we need students to eat healthy all the time and have breakfast. And obesity is linked to not only poorer performance in school, but also maybe poorer social skills. And maybe kids are bullied, or they're shy, or they're not as open because they're a little bit embarrassed. So, good nutrition can help to get kids healthier as well. Oh, I keep bumping it. As I mentioned, school meals are so important to students, and they're healthier than most other kids' meals out there. Whether you go to packed lunches tend to be less healthier than school meals. Restaurant meals that are trying to improve are less healthy. I mean, in every school meal, you're getting fruits and vegetables, low-fat milk, whole grains. These are ways, perfect nutrition for students, growing students. And most students are getting, a lot of families that don't have a lot of resources, most of their kids are getting more than 50% of their calories at school. And the more opportunities you offer them for healthy foods during the school day, they're more likely to have healthier intake. And although most competitive foods that meet nutrition standards, they're still not as healthy as the school meals. So I know we're meeting nutrition standards with competitive foods, but ultimately the school meals are the most healthy thing that our kids have access to. So it's really important to give them time to eat those. And we have so many opportunities for schools in California. So yay, California, we're always a leader. Universal school meals. So now, yay, this is so exciting. It was a pandemic success, and it's continued in California. We're this leader of the country. We're the first state in the country, and there's about 4 or 5 states that are following us, and of course a lot of pressure on the federal government, which don't think they're gonna get it done yet. But as they say, as California goes, so does the nation. So let's show how successful this can be. This reduces stigma, this increases participation, and everyone gets school lunch. It's no longer, oh, that's for the poor kids, or this is stigma. Everyone gets school lunch, just like everyone gets books, like everyone comes to class. I'm so excited about this to see what this brings to our students. We have a lot of farm-to-school programs. We are the biggest agricultural state in the entire country, and getting that fresh produce and fresh food to schools is really important. It tastes better, and it's local. It helps with climate. We know all of that. And California has invested in 3 regional food hubs, and I think that's another opportunity for schools to really get more local foods into the cafeteria. And school gardens, I know I saw some on the screen, and that's bigger. I know there's also more funding coming out from the state for school gardens, so it's just another opportunity for students to learn about nutrition, try fresh foods, and in some cases, I know policies and laws vary throughout the state, but in some places you can put that produce right into the school cafeteria as well. So I feel like we have a lot of opportunities to feed our students, well-nourish them, and bring fresh fruits and vegetables to the table. At the federal level, they're talking about nutrition, so there are some opportunities. A lot of federal funding does come into the state to support nutrition programs. And for the first time ever, USDA is talking about equity, so that's really important and great, right? They're focused on nutrition security, not just access to food, but access to healthy food and equitable practices. They want to reach everyone. And there is some talk about increasing access to free food for all. I don't know that it's going to make it on the national agenda, but again, they're talking about it. Summer meals, they're talking about, let's make, like you all probably are aware of pandemic EBT. That was an additional benefit during the pandemic. And now for summer meals, they want to also have a summer EBT. So that allows students to have more access to food over the summer, because we know intake goes down during the summer. There are summer meal programs, but not everyone participates, so this is a way to get more families, particularly in rural areas, to have more access to healthy food throughout the summer. There's been more support and funding coming out for kitchen infrastructure and training of nutrition professionals, so that might be of interest to you. The USDA will be putting out money. There's a bigger call to ensure that meals align with DGA, so to continue to have it meet the high standards, quality standards of health. And they're coming out with this Healthy Meals Incentive Initiative program using some of their ARP funding. So some healthy school challenges, and I think, again, more funding directly going to schools that are excelling and bringing health. So those are some opportunities for you all to consider. So nutrition is being talked about at the state and federal level from an equity standpoint, from a nutrition security standpoint. So we're doing well. We're moving along. We're making headway here. But now thinking about how does nutrition work across this whole child, whole community, whole school spectrum. So these are just some ideas to think about. How do we move nutrition across all of these different areas? So I'll kind of talk through that, and these are some ideas. But of course, with your school wellness council, you might want to be thinking about this. How does nutrition fit in across everything in across the spectrum? So within health education, it's including nutrition education as part of a comprehensive health education curriculum. So teaching about nutrition, also maybe teaching about healthy cooking, right? Because some students don't know how to cook, so that could be another way to get kids excited. With PE and gym and physical activity, ensuring water is available. We know hydration is really important, and that's a component of nutrition. For meals and services, and ensuring there's enough time to eat so kids can actually eat their food. So making sure that you're thinking about that. It's so exciting. We have more students eating lunch, but have we thought about, is there enough time for them to get through the line and eat their food? Health services, really tailoring that to students' health needs, do students that have food allergies or diabetes, making sure that they're getting the proper nutrition that they need as well throughout the day. Also, maybe you might train school staff to recognize eating disorders within students so we can help them in that from a psychological and social service perspective. One thing that I brought, ensure that food is never used as a reward or punishment. That is helpful because sometimes we don't want people to affiliate food as a reward or a punishment, right? We just want food to exist and be there. So maybe making that, let's give non-food items as rewards and let's just keep food as part of, when we're hungry and mealtime and snack time. Physical environment, we talked about gardens a little bit, creating a garden on site or maybe doing small pots in a classroom where they can take home so that they can have a physical environment that reinforces these behaviors. Also, don't forget, employees are at the school site too, ensuring that they have access to healthy food and physical activity and on campus as well, so that we can keep employee wellness front and center. Family engagement, you might be able to send materials home in multiple languages to ensure parents can receive the resources and understand them. And with community involvement, you might do something like joint use agreements where you're opening up your school site for community kitchens, food pantries, school gardens. So those are just ways to get involved and look at nutrition across the whole spectrum, not just as food service alone, and there's different ways to build that in. Oh, and I gotta hurry. The next one, I'm gonna talk a little bit about family engagement. I mean, who knows better about their families than families themselves, and how can they be really supported? So really family engagement is families and school staff working together towards health and wellness and better education. Families have meaningful opportunities, are actively engaged, and we're engaging those students throughout as the child matures into adulthood. And I'll kind of talk about that first when they're little and they're in elementary school and maybe early middle school, we're engaging the parents. But as they get older, we can directly engage the youth in these activities that build skills in them, and that also continues to build them with valuable skills going into adulthood. So with the CDC has a book out about parent engagement, and it really gives you some ideas on how to generate enthusiasm, share information, identify meaningful volunteer opportunities for parents, and initiate steps to help implement a parent action plan. So parents can be actively involved on your site in different activities, whether it be, and I'll talk a little bit more about that, but different activities in the classroom, out of the classroom, at events, right? Really just being part of the school community. And why is this important? It actually, when families are more engaged and involved, students do better academically, parents have higher appreciation for the teacher, and there's better relationships across this spectrum, so it does overall improve academic achievement. So family engagement does improve it. I'm gonna talk about a couple resources. So Parents in Action is a 6-lesson curriculum that we have that really focuses on engaging parents around health and wellness, and also you can see the 6 lessons on the screen. It's in English and Spanish. But then we go through a 4-step advocacy process where then the parents might pick a problem on site, identify solutions, determine what policy actions they might need to do, who do they need to talk to at the school site to make this change, build an action plan and evaluate their progress, and celebrate, small changes add up to large changes over time. And what we've seen that engaged parents have been able to really advocate for healthier foods and beverages options and physical activity on improving the school environment. So they've developed healthy classroom party and classroom rewards guidelines, submitted successful grants, participated in the school wellness committee, reviewed local school wellness policies to make them stronger, just a whole host of things. So they've really been bought in and helped to support some of what you all want to do, push that forward in action on site. And then youth engagement, I talked a little bit about this, but older youth can really have a lot of input on what happens to them. They're the students, they're in an environment that they have to go to every day. So why do we want to? They are positioned well to work on positive social change. And I know a lot of the examples I'll share are around physical activity and nutrition, but we talked about mental health. Who knows youth better than themselves? Youth can probably come up with some great solutions for other youth on improving mental health. Because youth know youth the best. It's unique. They know, they're connected in, they know what's going on, they know the undercurrent that us adults may not be quite savvy about. They are our stakeholders in these communities, so we need to listen to them, and they're great spokespeople. Others listen to them. When students ask for things, people tend to want to give it to them, right? Because they know what's happening. And they're ready to take on leadership. And it is opportunities for them if they want to go on to higher education. This could be part of what they, promote. So youth, we have some youth engagement programs where youth work with an adult ally on site, and they really identify issues that are happening in their school or, surrounding community. They learn more about healthy behaviors throughout the process. They investigate issues. They develop solutions, and they work together to come up with, this is what we want to promote, and they prepare to talk to decision makers about the changes they want to see, and then they're usually successful in implementing community change. And you can see that thing. After students participate, they feel more engaged, they feel more empowered, they're practicing healthy eating and beverage behaviors, being more physically active. So it's a win-win overall, right? Some of the policies and things that they've worked on throughout the years are creating complete streets policy, cafeteria share tables. They were worried about food going to waste, knowing other students needed it, so they created these share tables to share food that people didn't want, cafeteria makeovers like smarter lunchroom. They've been critical in some of those activities, hydration stations on school campus, peer-to-peer education. So now they're going into other classes, maybe younger students, and educating them on these important issues around health, nutrition, and physical activity. They've created in some districts, a community food pantry where they're actually giving out food. They knew there was a lot of needy families in their site. And they've worked on joint use policies where, again, opening up the school community for physical activity and also leading physical activities. So there's a lot that they have been able to do. So just a quick run through again, how does family engagement work across the whole spectrum of whole school, whole community, whole child? So offering parenting classes, entering parents to serve as mentors or coaching, right, bringing their skills into the school community. They have their own gifts. Coming in and helping to change the cafeteria, testing new food products, getting on board, being engaged in that. Schools offering health clinics. I know I saw a lot of vaccine clinics come out of school that were very successful for using school as a vehicle to get vaccines and other screenings to the families. Looking at system-wide approaches for safety on a school site, right? I know that's a big concern for a lot of families, so engaging the families in those activities. Building kind of a social-emotional learning council where you include families, youth, and parents to help support activities on campus. Assessing air and light and quality on campus. Recognizing parents are also employees, so creating employee wellness that includes parents, right? They're often wearing two hats. Having PTAs or PTSAs that they really are having decision-making power on campus on things that happen. And again, joint use agreements. Maybe it's for physical activity this time where it's family walking clubs or parent walking clubs so they can connect. We talked about people need more social connectedness, and that can also help to do it. So just in closing, schools are a great area where we can do a lot to support families, but we also need a whole society approach to really help policies to promote health and wellness for children and youth, right? So there's some ideas out there that would also help further support health and wellness within students. So thinking about restrictions on children's advertising, healthcare and food for all programs. So again, everyone qualifies regardless of their status, right? Like hunger and health has, that shouldn't matter. Everyone who needs food should be able to get food, same with healthcare. Produce and Park RX programs through Medi-Cal, Medicaid to help just increase access to health, school physical activity policies and programs. I know they're out there, but really enforcing those to keep PA front and center. We always see PA being cut. And soda, sugar, sweet, and beverage taxes are really a way to raise revenue because we're always like, where are funding coming from? And we've seen great things happen with that, from early child care education for all and things like that. So these are a whole society approach to really wrap around health for our young citizens. So I want to thank you for your time, and thanks.
Thank you, Amy, for calling attention to health equity, racial justice, to opportunities that we can incorporate to nutrition education, addressing nutrition security, strategies to engage our families, including parents and students, in our overall wellness efforts. Amy shared a number of various strategies and policies, actually, that you can add maybe to your wellness policies that you then eventually put into practice and implement. As she said, that wellness is an active pursuit, meaning it's action-oriented. So thank you, Amy.